Hello, my name is Courtney Schuckman and I'm a registered dietitian at the University of Chicago Medical Center. I will be reviewing an article titled Curcumin in combination with mesalamine induces remission in patients with mild to moderate ulcerative colitis in a randomized control trial. This was published in February of 2015. The mainstay therapy for patients with mild to moderate active ulcerative colitis is a combination of oral and topical mesalamine. The combination of the two has been shown to be superior to oral treatment alone. Failure to respond to optimized mesalamine drugs often requires escalation to corticosteroids and/or immune modulators, which carry potential side effects. Curcumin is a natural phytochemical derived from the Indian spice turmeric. It's been used in Ayurvedic and traditional Chinese medicine to treat various inflammatory diseases. It has been shown in vitro experiments to have anti-inflammatory and antioxidant properties. It's also been found to be superior to placebo in maintaining remission in ulcerative colitis patients up to 12 weeks. The aim of this study is to investigate the efficacy of curcumin as an add-on therapy with optimized mesalamine treatment for the induction of remission in active mild to moderate ulcerative colitis. Patients were recruited from 3 medical centers in Israel, Hong Kong, and Cyprus over a 3-year period. Patients were included if they had mild to moderate active ulcerative colitis based on a simple clinical colitis activity index score of greater than or equal to 5 and less than 12. They had to be between the ages of 18 to 70 years old with endoscopic or histologic diagnosis of UC. If they were on immunomodulators, they had to be on a stable dose maintained for 12 months prior to inclusion. Patients were excluded if they were on current or recent corticosteroids, if they were being treated with anti-TNF or cyclosporine, if they had abnormal lab findings, significant comorbidities like renal or liver disease, if they had C. diff or active infections, or if they were pregnant or nursing. This was a multi-center randomized double-blind placebo control trial. Patients on maximal mesalamine treatment, which was oral and topical treatment, were included in the trial. If they weren't on optimized treatment, they underwent a 2-week run-in period where they received 4 grams of oral mesalamine daily, in addition to either a 1 gram per 4 gram enema or a 1 gram suppository daily. Patients who still had mild to moderate UC based on an SCCAI score greater than or equal to 5 were enrolled in the trial. Patients were allocated to receive either 1 month of 3-gram oral supplement of curcumin or a placebo. Curcumin was given as 3 capsules twice a day before meals. At baseline and 1 month after the intervention, patients underwent physical examination and lab testing. Clinical status was evaluated by SCCAI score. Consenting patients underwent sigmoidoscopy, and endoscopic activity was determined according to Mayo Index subscore. The primary outcome was the percentage of patients in clinical remission at 1 month. This was defined as an SCCAI score less than or equal to 2. Secondary outcomes were the percentage of patients with clinical improvement, defined as greater than or equal to 3-point decrease in their SCCAI score, the rate of endoscopic remission, defined as endoscopic Mayo score drop of greater than or equal to 1 to a score of 0 or 1, the mean change in endoscopic activity score, and the rate of endoscopic improvement defined as any greater than or equal to 1-point drop in Mayo endoscopic subscore. 97 patients were screened for the study, 50 were enrolled, 26 were allocated to receive curcumin, and 24 were allocated to the placebo group. 3 patients were excluded from the per protocol analysis, but were included in the intent to treat analysis. There were no significant differences between the 2 groups at baseline. 9 patients were treated with immunomodulators in addition to mesalamine, 4 in the curcumin group, 5 in the placebo. There were no differences in outcomes amongst these groups. There were also no new laboratory abnormalities observed for either group. In the intent to treat analysis, clinical remission was achieved for 14 of 26 patients receiving curcumin and 0 patients in the placebo group. Clinical improvement was achieved for 17 of 26 patients in the curcumin group and 3 of 24 patients receiving placebo. Endoscopic evaluation was available for 38 patients, 22 in the curcumin group, 16 in the placebo group. Endoscopic remission was observed for 8 of 22 patients receiving curcumin and 0 patients in the placebo group. Endoscopic improvement was observed for 10 of 22 patients receiving curcumin and 0 patients in the placebo group. In conclusion, the findings of this trial suggest that curcumin as an add-on therapy with optimized mesalamine is superior to optimized mesalamine alone in inducing clinical remission in patients with mild to moderate UC. The limitations of this study are the small sample size, the short study duration, there's a potential dose response, but this was not assessed in this study, and endoscopic evaluation was only available for 76% of the patients. Ultimately, further clinical large-scale trials are necessary to determine the use of curcumin for inflammatory bowel disease.